Welcome, everyone. I'm excited to kick off our presentation today on diseases of the musculoskeletal system. This is the first slide, so I just want to warmly welcome you all and share what we'll be exploring. We'll look into various conditions that affect muscles, bones, and joints, and discuss their causes, symptoms, and treatments. So, let's get started and dive into this important topic together. Let's take a closer look at the anatomy of the musculoskeletal system. This system is made up of several key components that work together to support, move, and stabilize our bodies. First, we have the muscles, which are responsible for generating force and enabling movement. Next are the bones, which provide the structural framework and protect our vital organs. Joints are the points where bones meet, allowing for a range of movements and flexibility. Ligaments connect bones to each other at these joints, offering stability and support. Lastly, tendons connect muscles to bones, transmitting the force generated by muscles to produce movement. Together, these elements form a complex, yet incredibly efficient system that is essential for our everyday functions and overall mobility. Understanding this anatomy helps us appreciate how our bodies move and how injuries can affect our performance and health. Let's take a closer look at the anatomy of muscles. There are three main types: cardiac, skeletal, and smooth. Each has its own unique role and characteristics. Smooth muscles are interesting because they help control the flow of substances within the hollow organs, like your intestines or blood vessels. They operate involuntarily, meaning we don't consciously control them. On the other hand, both skeletal and cardiac muscles have visible striations when you look at them under a microscope. These striations are important because they reflect the internal structure and organization of the muscle fibers. Cardiac muscles are specialized muscles found only in the heart. Their main job is to circulate blood throughout the body. Like smooth muscles, they are not under conscious control, which allows the heart to beat automatically and rhythmically. Skeletal muscles, however, are attached to bones and are responsible for voluntary movements. They are arranged in opposing groups around joints, enabling movements like bending and straightening. Understanding these differences is key to appreciating how our muscles support various functions, whether voluntary or involuntary, and how they work together to keep us moving and alive. Let's take a closer look at the anatomy of a bone. Bone is a living tissue, which means it's constantly changing and adapting to our body's needs. It makes up the entire skeleton, giving us structure, support, and protection. Within the bone, there are three main types of tissue. First, we have compact tissue, which forms the dense, hard outer layer. Next is cancellous tissue, also called spongy bone, which is more porous and found inside. And then there's subchondral tissue, which is located just under the cartilage in joints. Surrounding the bone is a tough, thin outer membrane called the periosteum. This periosteum isn't just a protective layer. It also serves as a point of attachment for muscles, ligaments, and tendons, connecting soft tissues to the bone and facilitating movement. Now, bones aren't all the same shape. They are classified based on their form. Long bones, like the femur or the bones in your forearm, are longer than they are wide and are often involved in movement. Short bones, such as those in the wrist and ankle, are more cube-shaped and provide stability. Flat bones, like the skull, are thin and broad, offering protection for internal organs. Lastly, irregular bones, such as the vertebrae, have complex shapes that serve various functions. Understanding these structural components helps us see how bones support our body, enable movement, and connect with other tissues, fundamental themes in our exploration of the skeletal system. Let's take a closer look at the anatomy of the bone. In an adult human, there are about 206 bones that make up the skeleton. Now, this number doesn't include teeth or some of the smaller bones called sesamoid bones, which are found within tendons. These sesamoid bones are interesting because they help protect tendons and increase their efficiency. Breaking down these 206 bones, we can divide them into two main categories: the axial and the appendicular skeleton. The axial skeleton consists of around 80 bones. These are the central bones of the body, including the skull, the hyoid bone in the neck, the auditory ossicles in the ears, the vertebral column, the ribs, and the sternum. These bones provide support and protection for vital organs like the brain, spinal cord, and heart. On the other hand, we have the appendicular skeleton, which includes approximately 126 bones. These are the bones of the arms, shoulders, wrists, hands, legs, hips, ankles, and feet. Essentially, these bones are responsible for movement and support the limbs, allowing us to perform a wide range of activities. Understanding this division helps us appreciate how the skeleton is organized to both protect vital organs and enable mobility. It's a perfect example of how structure and function work hand in hand in our bodies, which ties back to our overall focus on human anatomy and health. Let's take a closer look at the anatomy of bones in the upper extremity. Starting with the shoulder girdle, we have the clavicle, also known as the collarbone. It plays a crucial role by connecting the shoulder to the sternum, providing stability and support. Next is the scapula, or shoulder blade, which is a flat, triangular bone located on the back of the rib cage. This bone helps facilitate shoulder movement and serves as an attachment point for muscles. Moving down to the arm, the main bone here is the humerus, which is the single bone of the upper arm. It connects the shoulder to the elbow and is vital for arm movement and strength. In the forearm, we find two bones, the radius and the ulna. The radius is on the lateral side, that's the thumb side, and the ulna is on the medial side, closer to the pinky. At the wrist, or the carpal region, there are 8 small bones arranged in 2 rows. The proximal row includes the scaphoid, lunate, triquetrum, and pisiform, while the distal row has the trapezium, trapezoid, capitate, and hamate. These bones work together to allow wrist movement and flexibility. Moving further into the hand, we have the metacarpals, 5 long bones that make up the palm. Each finger contains 3 phalanges, the proximal, middle, and distal, except for the thumb, which only has 2, the proximal and distal phalanx. Understanding this detailed anatomy helps us grasp how the upper extremity functions and moves, which is essential in many fields from medicine to sports science. Now let's take a closer look at the anatomy of the bones in the lower limb. Starting with the thigh and leg, we have the femur, which is the single bone of the thigh. It's actually the longest bone in the entire human body, providing a strong structure for supporting our weight during activities like walking and running. Next, we have the patella or kneecap, which is a small sesamoid bone, meaning it's embedded within a tendon. That protects the knee joint and helps with movement. Moving down the leg, the tibia or shin bone is the larger weight-bearing bone. It plays a crucial role in supporting the body's weight and enabling movement. On the smaller side, there's the fibula, located laterally, which provides stability to the leg but doesn't bear as much weight. Now, shifting our focus to the foot, the first set of bones are the tarsals, 7 bones located in the ankle area. These include the talus, which forms the ankle joint, and the calcaneus, better known as the heel bone. These bones work together to provide stability and mobility to the foot. Next, we have the metatarsals, which are 5 long bones that form the sole of the foot. They help us balance and push off during walking or running. Lastly, there are the phalanges, 14 small bones that make up our toes. These bones are essential for maintaining balance and enabling fine motor movements in the toes. Understanding this detailed structure helps us appreciate how the lower limb bones work together to facilitate movement and support our everyday activities. Let's take a closer look at the anatomy of the bones in the vertebral column. The human spine, or vertebral column, is composed of 33 individual vertebrae. These vertebrae are divided into 5 distinct regions, each with its own specific characteristics and functions. Starting with the cervical region, which consists of 7 vertebrae. These are located in the neck area and are responsible for supporting the head and allowing for a wide range of head movements. Moving down, we have the thoracic region, made up of 12 vertebrae, which attach to the ribs and form part of the thorax. Next is the lumbar region, with 5 vertebrae, supporting much of the body's weight and providing stability for the lower back. Below that, we have the sacral region, which includes 5 vertebrae that are fused together to form the sacrum. This structure helps connect the spine to the pelvis. Finally, the coccygeal region consists of 3 to 4 fused vertebrae, forming the coccyx or tailbone. What's important to understand here is how these vertebrae are arranged. This arrangement not only provides necessary support and structure, but also allows for flexibility and movement. At the same time, this precise organization helps protect the spinal cord, which runs through the vertebral foramen of each vertebra. So, the overall design of the vertebral column is a perfect balance between mobility and protection, which is essential for our daily functions and overall health. Let's take a closer look at the anatomy of joints. A joint is essentially any place in your body where two bones meet. Joints are classified based on two main factors: their function, which is how they move, and their composition, or what they're made of. Now, depending on how much a joint moves, we categorize them into three main types. First, we have synarthroses, which are joints that don't move at all. These joints are primarily responsible for providing structural support and stability to your skeleton. Think of the sutures in your skull; those are classic examples. Next, we have amphiarthroses. These joints allow limited movement, offering a nice balance between stability and mobility. They're essential for functions like absorbing impacts or providing some flexibility, such as the joints between your vertebrae. Finally, there are diarthroses. These are the joints you're most familiar with because they allow free movement in most directions. These are the joints that give us the greatest range of motion, like your elbows, knees, and shoulders. Understanding these categories helps us see how the structure of a joint relates directly to its function, which ties back to the overall theme of how our body is designed for both support and movement. Let's take a closer look at the anatomy of joints. Joints can be classified based on their histology or the tissue types they contain. First, we have fibrous joints. These joints aren't very flexible at all, and some of them don't move whatsoever. They usually contain a lot of collagen, which gives them strength and stability. An example of fibrous joints would be sutures in the skull or the joint in the jaw. Next, we have cartilaginous joints. These joints are cushioned by a layer of cartilage that connects the bones. Because of this cartilage layer, most of them allow some degree of movement. Think of the pubic joint as an example. It's a joint that provides stability but also allows limited motion. Finally, the most mobile type of joints are called synovial joints. These are what we typically think of as freely movable joints. They consist of a cavity in one bone that fits into a corresponding socket in another bone. A key feature here is the synovial membrane, a fluid-filled sac that lines the joint space. This membrane produces synovial fluid, which lubricates and protects the joint, enabling smooth movement. Some common examples of synovial joints include hinge joints, like the elbow, ball-end socket joints such as the shoulder or hip, condyloid joints, pivot joints, and saddle joints. These joints give us a wide range of motion and are essential for our daily activities. So, understanding these different types of joints helps us appreciate how our body combines stability and flexibility, depending on the specific function required. Osteoporosis is a disease where your bones become weak and more prone to fractures or breaks. This can happen when your bone mineral density and overall bone mass decrease, making your bones less sturdy. It can also occur if the internal structure and strength of your bones change over time. Now let's talk about the risk factors. The first and most significant one is age, specifically being over 65 years old. As we age, our bones naturally lose density, which increases the risk. Another important factor is gender. Females are at a higher risk, especially after menopause, due to hormonal changes that affect bone density. Family history also plays a big role. If osteoporosis runs in your family, you might be more susceptible. Lifestyle choices matter too. Smoking, for example, can weaken bones and accelerate bone loss. Understanding these risk factors helps us recognize who might be more vulnerable and underscores the importance of early prevention and management strategies throughout our presentation. When coding for osteoporosis with a current pathological fracture, it's important to use the codes from the M80 series in ICD10 CM. These codes are quite detailed. They specify the exact site of the fracture, whether it's on the left or right side, and the stage of care the patient is in. This helps ensure precise documentation and appropriate billing. If the patient has osteoporosis but does not currently have a fracture, then we turn to the M81 series codes. And don't forget, if the patient has a history of a fracture in the past, it's important to include a history code to reflect that. Now, let's clarify what a pathological fracture actually is. It's a fracture that occurs in a bone that's already weakened by disease, such as osteoporosis. What's key here is that the fracture is caused by a fall or trauma that wouldn't normally break a healthy bone. This distinction is crucial because it impacts how we code and interpret the situation. Understanding these coding guidelines helps us accurately reflect the patient's condition and ensures consistency across clinical documentation. It's all about capturing the full picture, the site, the stage, and the history, so that our coding aligns with the overall goal of precise, comprehensive patient care. In this final slide, we're focusing on the coding guidelines for M00 through M99, specifically for chronic musculoskeletal conditions. It's important to remember that only chronic conditions within this chapter can be coded here. For acute musculoskeletal conditions, we need to use Chapter 19 instead. Now, when it comes to site and laterality, many musculoskeletal conditions involve specific bones, joints, or muscles. So, the ICD10 CM codes in Chapter 13 often require us to specify exactly where the problem is located. That means indicating whether it's the right side, the left side, or both sides of the body. This detail helps us accurately capture the patient's condition. Let's also talk about conditions that affect multiple sites. For example, osteoarthritis can involve several joints. In such cases, you'll want to look for a code that specifically mentions multiple sites if it's available. If there's no such code, then you'll need to assign individual codes for each affected site. For instance, if a patient has osteoarthritis in the right knee and the left hip, you must specify both sites separately. Depending on what's available in the coding system, you'd either use a special multiple sites code or assign two separate codes, one for the right knee and one for the left hip. This approach ensures we document the full scope of the patient's musculoskeletal issues accurately, which is essential for proper coding and billing, and ultimately for quality patient care.